This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Good morning, everybody. So a couple things I was going to talk about that I recently learned I thought were interesting about our automated blood pressure cuffs. Probably not the most exciting thing when you just briefly think about them, but the way that the automated blood pressure cuffs work is kind of interesting. You know, they basically squeeze and then they spit out a number. What they're doing is actually they're measuring a mean arterial pressure, and then they are calculating a systolic and diastolic. Not like the way you do a manual where you kind of oscillate the systolic and diastolic. And each company has like a different algorithm for how the blood pressure cuffs actually calculate that systolic and diastolic. But what that means for us is that what's actually measured and what's actually reliable is the map. The systolic and the diastolic aren't necessarily as precise. So sometimes if we're trying to titrate a pressor to a map, then the automated blood pressure cuff is probably pretty accurate. But if you're doing something like managing blood pressure for intracranial hemorrhage or an aortic dissection, where you're trying to lower the blood pressure to a very specific systolic, then we might need to be just a little more cautious with those cuffs. Sometimes if we're really not sure and we're really kind of needing that precise number, sometimes either getting a manual every so often or an A-line give you much more accurate systolic and diastolic blood pressures. Other things are that the size really does matter with these cuffs when we talk about it, but if you either have a cuff that's too big or too small, the automated cuffs can be way off. Another thing is sometimes you guys, we've all seen this, that you have a kind of a sick patient, think they're hypotensive, the pressure, or they're really hypertensive, and the cuff cycles and cycles and cycles, and it's like 10 cycles, and it spits out a number. We should probably be a little cautious with that number. And they're like, oh great, this person's blood pressure is 120/80, and they look like they're dying. We should be cautious and kind of cycle it a couple more times, because it's probably just throwing out a number that might not be very accurate. So again, if in those situations, a manual can be pretty helpful. Don't hesitate to get the manual blood pressure cuff in there. A couple interesting things about those automated cuffs that we use all the time, but I don't think about very much.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.